pharmacist about any allergies to any medications that you're taking. And if you have any old medicines around the house and you're not, get rid of them. Get rid of them. Because you don't want to get them confused with the new medication. And I don't know about you, but I've been watching too much television about young people getting into prescribed medication. That's another reason to get rid of the medication. Get rid of it. Don't flush it down the toilet. Put it somewhere. Take it and grind it up and throw it in the trash or something. Well, what about going to the hospital? Again, take your medication list with you, and remember to include non-prescriptions on the list. Some medication interaction can be harmful with vitamins and other stuff, and it might cause a problem with blood tests. Nursing staff or other hospital members should look at your barcode bracelet if you're in the hospital before they do anything with you. Before they give you medication, take x-rays, or blood. They should look at this bracelet. And this, you know what this looks like, don't you? If you've ever been in a hospital, they give you this bracelet. And it has your name on it, your doctor. Make sure they have that. Make sure they look at that. For the most part, your safety and health care is very important to the doctors and the nurses and pharmacists. Hand washing is another important area. Observe the staff when they come into your room. Because usually what they're doing is going from one room to another room. And what they're doing is bringing what that was in that room to your room. I don't know if you ever heard about MRSA. Yes. MRSA, very dangerous. Make sure they wash your hands. And you have a right to say, no, don't touch me, you need to wash your hands. They should also be wearing gloves. And they should wash their hands after removing those gloves. They get busy, and let's face it, we all do. We all do get very busy. 1 Corinthians 12:1 addresses spiritual gifts and stresses the importance of not being ignorant. Now concerning spiritual gifts, brethren, I would not have you ignorant. Scripture relates to everyday life. This is the gift of being able to speak up for yourself concerning your health and as a caretaker of God's holy temple. Know who is taking care of you in the hospital. Caregivers in the hospital are important to your health and in the hospital. Make sure you know who is taking care of you. Look to see if the caregiver is wearing an identification badge with a photo and a name. I think you might have heard recently about a story in Orlando when this young man was in a hospital. He was treating patients, taking care of patients. Know who's taking care of you. Don't be afraid if somebody comes in, well, who are you? Or what are you here to do? This is your body. You wouldn't let a stranger touch your body. Because he works in a hospital, he's still a stranger. Don't be afraid to ask the person, again, who they are. And know your rights while you're in the hospital. Know your rights while you're in the hospital. Did you know you have a right to considerate and respectful care? Did you know you have a right to information about your care in language that you can understand? If they come in there talking about this treatment, and this limb and that limb, hold it. Put it in terms I can understand. Tell me, I didn't go to medical school. You did, but I want you to put it in terms, I'm not stupid, I'm not ignorant, but put it in terms that I can understand. Know, again, who's taking care of you. And that includes students. There will be students taking care of you. And you have a right to refuse to let those students do anything for you. But you need to know that they are students. And they have to learn somewhere, okay? But have them let you know that you have the right to know who they are. You have the right to make decisions about the plan of care before, during, and after treatments, and refuse recommended treatment or plan to the extent of law and the hospital policy. And you should be informed after you make these decisions of the consequences of your actions. As a patient, you have the right to have advance directives and expect the hospital to honor them to the extent permitted by law and the hospital policy. You have every right to considerate privacy. They should knock on your door. Don't stroll in there like, hey, you, hey, no. And you expect them to be professional about it. This is your body. This is God's temple. You have a right for them to treat you as such. Most hospitals pride themselves on their ability to provide the best care to their patients and will make every effort to provide quality, respectful, and support your dignity. In the case where you feel your rights have not been honored, speak to your doctor or your nurse. Other resources available to you are the hospital social workers, and some hospitals have patient advocates. These are people who will stand up for you. These are people who will say, this patient doesn't like the way you treated her, you didn't treat her with respect. Those are patient advocates and social workers.